We have some good news. Based off of our public pressure and feedback to the HICPAC guidance, the CDC is sending HICPAC's draft back for revision, where there will also be a future meeting where there will be a chance for more public comments. You can go to this link here to learn more about it. Ultimately, it's a great step in the right direction, but we still have a long way to go. Now let's dive into what the CDC actually wrote in this statement. Now, as a refresher, the Healthcare Infection Control Practices Advisory Committee, HICPAC, met in November and weakened systematically the healthcare guidelines, protecting healthcare workers against respiratory infections like COVID. You can go to my YouTube and watch through the HICPAC playlist to see all of the ways that they weaken the guidelines. However, based off of all of our feedback, the public's feedback on these draft recommendations, the CDC is not rejecting their draft, but is asking for revisions. And recall that they only have 9 members. They need 14 members to be a legitimate committee, as per their charter. And their committee was heavily biased to people that are anti-vaccine, anti-mask mandates, who even penned a letter while they were a part of this committee saying that we need to see people's smiles. That's also on my YouTube channel. You can go read through that there. So to compensate for this, they're going to be expanding the work group and appointing new members onto this committee. So they're going to be keeping the current committee, which has the anti-science members. So to meet their charter, we should be getting 5 additional members, hopefully in ventilation safety, from the National Nurses United group, industrial and chemical engineers, among other professionals. And currently we don't know when this next HICPAC meeting will be set, so we'll keep an eye on that. One of the major red flags that we all noted is that they did not specify N95s. They took that out and put the general masks in that penned letter by the HICPAC committee, 3 members from the committee, 2 members and a consultant, where in their letter they equated just a surgical mask to an N95, saying that a surgical mask is equivalent to respiratory protection as an N95, which we know is not true. The CDC acknowledges it here, although they pretend that that wasn't the intent of the language, even though we know it was. Some recategorizing of the special versus extended air precautions. As from the current writing, COVID would be reverted to routine air precautions as opposed to special air precautions because it would not be a new disease, where the CDC is very disingenuous again, where they're saying that people may have interpreted this as limiting the precautions, the special air precautions to only new and emerging pathogens. That's literally how it was written, so there's not much room for misinterpretation there. So the hope is that the additional 5 members will strengthen this up and make sure that N95 protection and the higher level of respiratory precautions is followed with COVID. This is a weird one. I don't really understand why they threw it in there about voluntary use of a N95 respirator. This one honestly should just be obvious, like, of course, people should be allowed to wear it if they want to. But not only that, it should be required for healthcare workers. And then strengthening source control, because they leave it optional in the current draft of HICPAC. They leave it optional to wear source control or not. Like, you can refuse it, which means the person that's sick can refuse to wear a mask. So making sure this is done at all times for infected people so they don't infect other patients or healthcare workers. And then the CDC ends on a very weak note, saying that the COVID pandemic will not be the last one we face. We must be better prepared for the next pandemic, when we're still in a COVID pandemic. It has not ended. So overall, I'm still very disappointed of the CDC. But in terms of our collective efforts, this is a good first step. We just need to keep pushing to get everything that we need.